Hi class, my name is Elizabeth Kerns. I'm really pleased to share a few of my thoughts about healthcare with you today. I've spent the last almost 11 years of my career in the healthcare sector, and particularly in information technology leadership, and I'm currently a CIO at a large physician practice group. I feel so fortunate to have this front row seat in the healthcare industry during what I think are some of the most transformative years. And this was triggered by the 2009 and 2010 federal legislation for ERA and ACA. These laws included intense focus on implementing electronic health records, on meaningful use, on quality standards, transparency of information with patient portals and health information exchanges, and managing an incredible amount of data that all of these generated. But perhaps the biggest problem in healthcare today, as you've probably discovered already in your course, is skyrocketing costs that are really unsustainable. We are already over $3 trillion a year and 18% of our gross domestic product and growing. This is far more than any industrialized nation spends on healthcare, and the stunning part is that for all that we spend, we do not have the best quality of care, access to care, or life expectancy. So there's many reasons why these costs are so high, but I won't get into those today. What I wanted to share with you is a potential solution to lowering healthcare costs that CMS or Medicare through their Innovation Center has been working on for the last few years. It's called bundled payments. This program was launched in 2013 as a 5-year pilot. That is to, in the most simple terms, pay a flat bundled amount for an entire episode of patient care rather than paying each provider for each line item, which is the traditional way called fee-for-service. The premise of bundled payments is that it should lead to lower costs and higher quality of care. So for instance, if a patient needed a knee replacement, Medicare would pay a flat bundled amount for all care received from all providers starting 3 days prior to their surgery, which means the outpatient visits and tests, through the hospitalization, and for 30 to 90 days after hospital discharge. The after discharge means the time spent in skilled nursing facilities, rehabilitation centers, home health, and even including any hospital readmissions that might happen in that time frame. The idea is that if all of the various providers, often from different organizations and venues of care, would coordinate the care of a patient and furthermore spend time educating the patient on how best to care for themselves too, the care would be more efficient, there would be less duplication of tests, shorter length of hospital stay, fewer readmissions to the hospital, and using algorithm-based placement into the right level and lowest cost of post-hospital care. So it all sounds great. And by the way, bundled payment models have been around for over 30 years. They've been successfully piloted many times and proven to lower costs and increase quality. It's never stuck though. It's never been widely implemented. Why, you might ask? Well, this is really hard to do. It's really hard to implement because it requires redesigning workflow and care pathways, adding people to manage the program, and possibly even patient care coordinators, implementing technology systems and analytics to track all of these patients before, during, and after their hospital care, creating education programs for the patients, figuring out how to compensate the various providers from that one bundle payment, and most especially communicating across all of these venues of care. So many hospitals and health systems are able to realize favorable financials and clinical and operational outcomes with bundle payments, especially for the joint replacement programs. However, because many of the difficulties that I just mentioned, there are also so many others who are struggling to make this work. As such, CMS just recently announced that it is slowing down their bundle payment program, particularly the ones around cardiac procedures. I personally believe in this reimbursement model, but I also see the incredible challenges in implementing it in such a complex operating and financial landscape as healthcare is. One day, a payment system coupled with a care delivery model will hopefully emerge that captures the best of the experimental models, and at that time we'll have better healthcare, controlled spending, and healthy people. Thank you.